Good afternoon, and thank you for joining in. Today we have 319 confirmed cases of COVID-19 in Montana as of last night. We've tragically faced 6 deaths. We do have an estimated 57 patients who have recovered. And today we anticipate that our state lab will test in excess of 400 Montanans. Well, at this time, we may not be able to pinpoint exactly how long this pandemic will last or when Montana will face its peak. There are several things that we do know. We do know that staying at home will help flatten the curve. For every person who stays at home, the better our chances to fight this virus and protect our healthcare workers. For every person that we take out of the chain of transmission, the more likely that our healthcare facilities can handle the capacity to respond. The more likely we beat back this virus sooner, not later. Staying home, avoiding gatherings or hanging out with people outside, avoiding gatherings or hanging out with people outside of your immediate household. Only going out if you're an essential worker, to take a trip to the grocery store, or to enjoy some fresh air. These steps may seem extreme. In a state like Montana, they may seem too cautious. After all, we're a state with a small population and at times sparse. But we must not forget that here in Montana, we face some unique challenges. Every action that we take now will help us overcome these challenges, or even better, make sure that we never have to confront them. We don't have to become like New York, Louisiana, or Idaho. And I'll do everything I possibly can to try to make sure that that doesn't happen on my watch. We can and we must keep efforts up to flattening the curve. Today, I will be extending the directive to stay at home for an additional 2 weeks through April 24th. First of all, staying at home will give our healthcare facilities more time to secure adequate hospital supplies so that when we do have our peak of cases, we're fully prepared. I'd also encourage you to wear a cloth mask or face covering consistent with CDC guidelines in public settings where other social distancing measures are difficult to maintain, such as grocery stores or pharmacies. Please use cloth face coverings and not surgical masks or N95 masks that are really needed by our healthcare workers and our first responders. It's also important to know that while cloth masks do help protect those around you, they should not be used as a replacement to social distancing or other protective measures such as washing your hands. I even looked around from my own supply at home. If Tristan from the Flathead Beacon was actually here, he'd see a buff that they provide on a regular basis for runners, or the Billings Trailhead has had cloth, or my own fishing one when I'm out with a buff. The fact of the matter is that we can take some of these steps. They're not overly intrusive, and we're watching out for one another. We're watching out for our neighbors along the way. You know, we do face the same challenge that every other state in the nation does with obtaining the amount of medical supplies needed to meet the demand. In a state like Montana, each hospital can't rely just on their medical supply sources, especially in the competitive and expansive market we see during COVID-19. We're working hard to survey hospitals and other providers all across our state to account for their need, whether rural or urban. We're working hard every day to find supply and make sure that it ends up in Montana and then to be distributed all throughout the state. 2/3 of hospitals in Montana surveyed did report that they have orders being canceled. And that's one of the reasons why, even at the state level, we're working each and every day. Montana's received 5 times more masks, N95 masks, from our friends to the east, North Dakota, than we have from our federal partners. While we've received an adequate supply of other items such as gowns and gloves to meet the current need. We'll certainly need more. We turn to the private market each and every day. We put orders in and are waiting on the arrival of 1,095,000 masks, among other supplies. Hope to receive some of those by the end of this week, but I'm not going to count on it till I actually see that delivery receipt here at the state. And we won't stop working to obtain every supply possible, whether through the private side or from the federal government. I don't want a day to go by where a nurse or an ER doctor doesn't have sufficient PPE to keep them, other patients, and their families safe. I don't want a day to go by where our first responders don't have the masks necessary to do their jobs. I know I join many Montanans in wanting to ensure that our healthcare workers and first responders have adequate PPE. And by staying at home, we can actually help make that a reality. Additionally, we're a state where there can be long distances to access care. It's easy to look at the map of COVID-19 cases and see that many central and eastern Montana counties don't yet have a positive case. Well, that seems like a bright spot, and it is. Also recognize an outbreak in a rural community could easily overrun a local healthcare facility. The distances between critical access hospitals in Montana are long, far. It's already difficult for our fellow rural Montanans to access care, and we ought to make sure that those challenges don't become more cumbersome. We stay at home for the Montanans in our rural communities and for our rural healthcare workers. We've already seen some of the challenges that we can face in a rural community in Toole County. The state was notified about a case at a long-term care center in Toole County on the evening of March 25th. Local public health, working with their partners within the medical community, worked quickly to identify other possible cases and close contacts to help prevent further spread of the virus. Infection prevention protocols for COVID-19 were put in place at both the assisted living facility and the local hospital. There's now been 20 cases associated with that event, including 17 Toole County cases and 3 from neighboring counties confirmed in Toole County. Cases include 7 residents of an assisted living facility, 5 employees of that facility, 7 of a neighboring medical facility, and 1 family contact. All the residents in the long-term care facility are under quarantine, including 3 individuals diagnosed with COVID-19 who are currently in isolation, and another case that is no longer in isolation. An incident command structure has been established in Glacier, Toole, and Pend Oreille counties. Bob Sandman, who retired from the DNRC and was the head of a Type 1 firefighting crew, he has experience working incident command, is acting as that local incident commander. This is a partnership between the state, Montana Hospital Association, and local governments. It's being led locally. Resources have been sent from across the region to assist. Everything from staffing support from Kalispell Regional Hospital to a number of Montana Air National Guard airmen serving as personnel. A deep clean of the hospital occurred yesterday. Deep clean of the assisted living facility is occurring today or tomorrow. And at the state level, we're in daily contact with the incident command team and those working on it, and really do want to give a props or a shout out to the good work that's being done on the ground with that unitary command team. It really is making a big difference. Finally, we stay at home, not just because of our rural areas, but we stay at home so that we can more quickly rebuild a thriving economy. It's not a choice between a healthy population and a healthy economy. The two go hand in hand. Managing this public health crisis now will prevent longer-term consequences that could upend our economy for longer duration and with a worse outcome. I know and I recognize that this is an extremely challenging time for small businesses, medium businesses, workers, and family alike. We continue to strive to do everything that we can to help support those businesses and workers during this time. Along with the extension of the stay-at-home directive, we're also extending other directives on that same 2-week timeline, including the mandatory quarantine for certain travelers arriving into Montana from another state or country, the closure of all non-residential public schools in Montana, the restriction for on-premises food and beverage businesses, and the consumer protections to suspend evictions, foreclosures, and cancellation of utility services, including water, heating, and internet services, giving Montanans some critical financial support during this time. We continue to work to improve the process for filing for unemployment benefits, and from March 29th through April 5th, we issued over 24,000 payments to Montanans impacted by COVID-19. And today, we successfully sold bonds at a historically low interest rate in order to move forward with the planning and designing critical infrastructure projects across our state. In 2019, I signed legislation marking the first comprehensive statewide bond package in over a decade. Today, we made the first of 3 issuances of bonds at $33 million. We were able to do so in a volatile market created by COVID-19, in part because of our strong credit ratings and stable outlook predictions. By selling those bonds today, we're ensuring that when it is safe to do so, that we can immediately boost our economy by putting shovels in the dirt to both address infrastructure needs our communities have and create good-paying jobs. And the selling of those bonds today allows Montanans to continue with that planning and design process. When the time comes, we don't have to wait on selling bonds. That's already done. Instead, we'll be ready right away to build on our economy by beginning the construction, creating an estimated 412 jobs, more than $20 million in wages. Also like to share 2 additional directives that we're issuing today. Local and county governments are integral to the response to COVID-19. They shouldn't be forced to levy additional taxes on Montanans to access emergency funding passed by Congress to respond to the needs of residents in this economic situation. So I'm issuing a directive waiving the current requirement that local and county governments implement a $2 million emergency levy in order to access new funding from the Federal CARES Act. Local and county governments won't need to use all available emergency levies before they can access state emergency or disaster funding. It's a simple fix that makes sense as we all work together to safeguard our economies during the COVID-19 emergency. Additionally, Montanans across our state have been relying on first responders. We're incredibly grateful for everything they've done to fight this virus on the front lines. Today, I am issuing a directive to protect our first responders by providing the clarification needed to allow all first responders to be notified before they come into contact with someone that has tested positive for COVID-19. For example, if a person who is being monitored and is in isolation at home requests an ambulance due to breathing issues, the ambulance could be dispatched with an exposure warning, and emergency services personnel could be prepared with the appropriate PPE. There's already an established protocol to notify law enforcement, firefighters, emergency care providers, and corrections officers if they've assisted someone who's tested positive for COVID-19 after the fact. This measure will provide the information first responders need to safely do their job during this emergency and ensure that they can take appropriate precautions to protect themselves, their families, and to limit the spread of COVID-19. As we all work together to slow the spread of coronavirus, I'm daily reminded that we are in this together, and we'll get through it together. So thanks to all Montanans for their diligence and their sacrifice during this time. I'll now turn it over to questions. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. If the question has already been answered, if you press 5* again, you'll be taken out of that question queue. Questions?
Yeah, Governor Bullock, this is Troy Stockman from Montana Radio Company.
Hello.
And, yeah, this is Troy Stockman from Montana Radio Company.
Hey, Troy.
My question is there are cities, there are county, states across the country that have either looked at or are actively going now or are in a curfew situation. Is that something that Montana is considering in terms of getting people just to stay home?
Not considering it this time. It's a rapidly evolving and dynamic time, but by the same token, what we see is Montanans taking care of Montanans. And that people are taking this seriously, and they're only going out of their house to get a breath of fresh air or to go for some of those essential activities. So there's nothing that I've considered to date that would put in a statewide curfew. Please.
We had this question come into our newsroom today. It appears the intention of your order to keep construction essential was to keep vital projects in Montana going. Considering construction projects are greenlit under your order, what projects should be prioritized in your opinion?
Well, I think that, look, and my order is consistent with what the Department of Homeland Security looks at as critical infrastructure projects. So it's not mine to necessarily pick the winners and losers. I would certainly hope that any construction activities that are occurring, that they're doing everything possible that they can to follow the social distancing guidelines.
Well, follow up as well. You've also stated that people still can come into Montana and work on work-related reasons, for work-related reasons, not quarantined. Are you concerned that contractors driving in and out of the state could bring a new wave of coronavirus into the state?
Well, I think we're doing everything possible to mitigate that from occurring, and that I ask contractors and everybody in the private sector as well to use their judgment if they do enter into Montana. Please.
So there's no statewide mandate of how, local sheriff's office and police departments should enforce social distancing. I know in Missoula they don't, but Butte, even this weekend, cited someone who, had a group larger than 10 at their residence. Would you recommend all other jurisdictions do the same?
No, what I'd recommend is Montanans never allow it to get to a point where local law enforcement would need to intervene. I mean, reading that article, at least, this was the second or third time that concerns were raised before local law enforcement exercised anything. So at the end of the day, this is about us taking care of neighbors, not necessarily local law enforcement needing to interject all the time. So from that perspective, I'd encourage every Montanan to follow the social distancing guidelines and the directive. And I do appreciate as there is authority vested within local law enforcement, but I think that they're being very, very thoughtful in their approach. I mean, I have no doubt that any local peace officer loves going out as a result that either a business or groups aren't necessarily complying with the guidelines. So let's just hope that everybody actually does it. Question on the phone.
I think that's me. This is Nikki Willette from Yellowstone Public Radio. Thanks so much for holding this call. There are a few counties, including Flathead and Missoula, that are saying they've seen community spread. They're not showing up on the state count of how the community spread. Can you talk about why there's a discrepancy between what local health officials are saying and what you're posting on the state website?
So, Nikki, there are two different things. Community-acquired transmission is occurring in Montana. But that doesn't mean we've seen statewide community spread. I mean, public health officials aren't considering it to be community spread statewide because Montana doesn't have that widespread transmission that's evident in places like New York and Washington. And there's also many counties that have no known cases at this time. And what we're doing statewide is working aggressively to prevent that virus from spreading. We've consistently advocated for Montanans to receive supplies that they need to both perform the contact tracing, including in the counties or those communities that have said that they have community-acquired transmission occurring. So no, we're not seeing it statewide, but there is transmission that has occurred within a community. Sir.
Governor, you activated the National Guard last week at major ports like the airports and train stations. Have those guardsmen found any cases of COVID entering Montana?
No, so as of today, the guards tested 1,201 people. So when I say tested, that means as they're coming off, giving them a temperature check. They've referred 6 of those individuals to health care providers. None of those 6 to date have been COVID-19 positive, though. We have 88 soldiers and airmen activated as of today at our major airports and rail stations. Another phone question.
Hey, this is Holly.
Sure can, Holly.
So a couple of different questions.
Imagine that.
My specialty. We've seen a lot of reporting on that projections model from the University of Washington. And I think the first thing I'm wondering is if you're using that model at all to make any decisions, or if other people, other officials in the state are, or if there are any concerns with that model and if it works well for a state like Montana. And then wondering, as we're hopefully we see cases start to decrease in what we're adding daily, and hopefully moving toward a better place. I'm wondering what metrics you're looking at before you would consider rolling back some of your directives, and what you'd like to see before you feel like we're at a place where we can do that. And then if you're considering, would it be a phasing out of those, or
Sure.
would it be, how do you envision that looking, just based on the information you have right now?
Yeah, and thanks for the question, Holly. I mean, we do look at that model. We are actually looking at other modeling as well. Trying to get as much information as possible, recognizing that models are just that. And probably the greatest thing to impact a model isn't going to be a statistician. It's going to be what each and every one of us do in our homes, in our communities, to try to ensure that transmission is not occurring. Do I think that we've hit the peak at this point? No, I do not. I think we'll continue to see growth in cases. As far as then what we do on the backside and when we start lifting restrictions, haven't reached that determination yet and what that is. In part, we have to look at both what the transmission is, what the sort of increase in COVID-19 cases are, and what we're seeing in Montana.
Thank you.
Yes, ma'am. Another phone question.
Hey, Governor, this is Tristan Scott from Flood.
Hey, Tristan.
Hey, I'm glad to hear that you're putting your beacon buff to good use.
The beacon buff right there. If you were here, you'd see it. It's not the first time I've used it.
Yeah, no, I'm happy to hear that. Hey, understanding that your directive places some of the onus on Montanans to take care of Montanans, there's anecdotal evidence stacking up surrounding some of these large construction projects that continue to operate as essential, but may not have adopted social distancing measures or even added sanitization measures like providing hand washing stations on the job site. I'm just wondering, as you extend this directive, are you considering strengthening protections for members of this essential workforce
maybe by providing a way to anonymously report violations or complaints?
Well, I think, Tristan, we could, but I guess I'd also encourage that from those sort of, as the local anecdotal issues arise, that this is a partnership, and it's a partnership not just with the employers, but also local public health, so that if there's gross or flagrant violations, that those gross or flagrant violations should either be brought up at the state level or at the local level. Another phone question.
Hi, this is Corbin Cates Carney with Montana Public Radio.
Hi, Corin.
I'm wondering if the state website and the map of the tracking of some demographic data by age and gender. I'm wondering if the state is also tracking racial demographics.
I did ask that this morning. What's that? We can get it for you, Corin. We have a little bit of it, and we will get it.
Not by a little bit of it, it's something that the state makes a practice of collecting.
You want to, Dr. Holzman?
Numbers?
Or just, do we collect it? How could we get it out?
We do collect it, and we will be putting something out soon with some of that information. It is reported in the reports through the local public health, so it's getting that information in and then getting it to the state.
And then aggregated it.
And then aggregating it. We do have some preliminary numbers.
Here, why don't you come take the I'm going to turn over to Dr. Holzman, the state's medical officer.
Apologize. So this is a rough breakdown so far, and this can change as we get more information as it comes in. But at this point in time, about 95% of the cases have been white, 3.5 American Indian, 0.4% African American, 0.4 Asian, and 0.4 other. There has been no cases associated directly with the tribal reservations at this point in time, but we're monitoring all that closely.
Other questions? On the phone.
Eric District Montana. One of the no cases associated directly with the tribal reservations this time. Do we know how much testing has been done there? How many people were members of those communities that were tested?
We don't have specific numbers on how many individuals have been tested within our tribal communities.
Okay. And then, sorry, to pivot to a different topic, one other question on the 24,000 people unemployment payments that have made. Are those individual payments or individual workers in the latter? Do you know how many individual workers received that?
So I think that the 24,000 payments between March 29th and April 5th, that's 1 week, so it'd be individual workers. I look at between March 16th and April 5th, there's been 56,086 new and reactivated claims. So that would be individuals. Yep. Another phone question.
Governor Bullock, Sheila Callahan, Mountain Broadcasting.
Hi, Sheila.
Hi, good afternoon, and thanks for doing these calls. My question has regard to a story that came out yesterday. Allstate Insurance said that they were going to return $600 million in premiums to their customers because driving is down so much. There are other forms of insurance that are also related to utilization. Health insurance is one, and work comp is another. Are there any plans for the governor's office to contact the big three in Montana, Blue Cross, Pacific Source, or Montana Health, to talk about the possibility of
I think I have been in conversation with some of the individuals and leaders of the health insurance side, although those are largely regulated by the state auditor, and I've not made any request that they refund premiums, because I also think that they're also taking steps when it takes to make healthcare even that much more accessible for individuals at this time. But we'll continue to sort of monitor it. And I do applaud, because Allstate sent me that notice as well, and I applaud them recognizing that as their risk pool changes because of utilization, actually getting money back into the pockets of hard working Montanans, the difference may well end up with healthcare providers or insurance, that the risk pool can be increasing, not changing the way that you're having less driving. Last phone question.
This is Nikki Willett again from Billings Public Radio. How frequently are you in contact with the CDC to update them with Montana's numbers?
So, Nikki, that on a daily basis, that the public health lab is in contact with the CDC, providing them updates on Montana's numbers.
And if I could follow up on the question I asked earlier, I'm looking at Flathead and Bullock counties where health officials locally are saying there's communal spread, but then I look at the state website and it does not list those two counties as having local transmission. What's that discrepancy from?
What's that? Yeah, at the end of the day, Nikki, it's a local determination which sets that. It's not me saying that here's community-acquired transmission. So it's the local public health officials that make that determination, and then we report it up.
Okay, thank you. So just a lag in state reporting it.
Yeah, or either lag in state reporting it. I mean, what we've been reporting also is public health officials haven't said we've had community spread statewide, and it's the local determination, the local public health that says and reports out that community-acquired transmission then is occurring. And as I noted too, that yes, we're in contact with, like, the health officials are in daily contact getting the CDC data. I mean, I think that it's every other couple days I'm either on the phone with someone from the CDC or other individuals sort of along that chain myself. Yes, ma'am.
We've seen examples from other states when coronavirus enters prisons, and it's by all means devastating. We've seen concern from people across Montana saying that maybe our prisons aren't doing enough to screen and to make sure that those buildings are deep clean. What do you know about state efforts to ensure that that happens?
Well, I think that even last week we put out a directive on when it comes to prisons as far as the transport. The expectation of, and that, like, prisoner transport from outside is only now at the exception, or when the director of the Department of Corrections says so. And at that point also, any individual transferred in, as but one example, then would go through a 14-day isolation or quarantine process. We do even have some oversight of, as the Department of Corrections recognized in Toole County. Also, you have the prison facility in Shelby. There hasn't been any transmission in, or COVID-19 positive tests in Shelby. And I know that, look, our correctional officers and the correction staff take this very, very seriously and are doing everything that they can to make sure that prisoners and the staff are safe.
Is there any screenings for prison staff coming in, since they're mainly the people leaving and entering the building every day?
There aren't, like, daily temperature checks, no.
One final phone question.
Final phone question. I missed part of that. One more time.
Governor, this is AJ Everett, Glasgow Courier.
I can, AJ.
Sorry, the cell service is in the middle there. I had a question about testing numbers per county. I know this question's come up in the past, and I know the state's not tracking individual county numbers. Getting data from local governments included to be a little bit more difficult than I thought it would be. Are there efforts underway to determine how testing has been, or how testing accessibility has been spread across the state? Is that a number the state's trying to acquire?
Well, we don't collect sort of city county of residents on individuals testing on a regular basis. We also have sort of a regional nature of healthcare delivery. So many of our samples could come, like if you're looking at there in Glasgow, that it could actually be individuals from other counties or other communities. So we're not, it's not necessarily informative of either the amount of testing that might be in a community or the amount of efforts along the way, given that folks go from county to county. And one of the things that, again, that would encourage anyone, if they're symptomatic and those, to go to that healthcare provider, certainly to get tests, because at the end of the day, we want to, I think more testing's better. And, you know, we know that certainly the epidemiologists point out that areas like Gallatin don't have higher numbers as a result of over-testing, nor do places like Cascade have lower numbers as a result of under-testing. Sure.
One final question, Governor. The Surgeon General warned Americans this week that this is going to be a tragic period in America. Are you prepared for, or is the state prepared for that if this gets much worse over this next week or coming weeks?
Look, and I think knowing that we've lost 6 Montanans, it's been a tragic period already. And also I know that the steps that Montanans take, because I think what the Surgeon General's statements were in part is what you're seeing now in especially our larger communities are, unfortunately, the mortalities, the deaths from actions taken or not taken 2 weeks ago with the transmission. So we are doing everything we can to prepare not just for this week, but for next week and the week after. And any loss of life is certainly tragic. And I think Montana's a state where, no, we may not have hundreds, but every Montanan feels something when we end up reporting out another loss of life. And we'll continue to do everything that we can to mitigate that, lessen that from happening. But that's also why we ask every Montanan to do what they can as well, because we're all in this together. Thank you very much.